My name is Dwayne Dean. I am a recovery coach professional facilitator. I am also a certified peer recovery specialist and a registered peer supervisor. I work with the University of Maryland, College Park Global Mental Health and Addictions Program, where we do peer-led research studies that measure adherence and retention with the peer role. We work domestic and globally, so we have studies domestic and here in Maryland, and then globally in South Africa and Bogota, Colombia. I am also the principal facilitator and principal or lead consultant at Peer Recovery Training and Support Services, where we train peer recovery specialists, and we also do organizational or recovery organizational consultation for inclusion of the peers within the workforce. I'm also a person in long-term recovery. I've been in long-term recovery for a little over 10 years, and what that means to me is that I haven't found a reason, need, or excuse to use any amount of mood-altering substances for a little over 2 years. Understanding research, how it helps me do my work, it allowed me to start to see a larger picture instead of looking at things from a lateral standpoint as far as me doing direct care or working directly with a recovery or participant. Now I get to stand back and see the larger picture and how it affects a community, a population, a system. It made me kind of hunger to know more what other parts of the puzzle fits into the work that I do. So it allows me to really see it from a broader perspective. Research impacts our communities by helping us to better support the populations that we serve, to find evidence-based interventions, to find standards or good practice that can benefit the communities. I think that the benefits of research is that we get to collect the data so that legislation, so that funding sources have the tools they need to support the populations that we serve. When we're looking at effective recovery supports dealing with organizations, universities, I believe that the community has to come together and collab. So research has brought universities and community organizations together with recovery supports to address the population on a global scale. So that could start from the community, the local, and even nationally or globally. As you're doing the work, the direct care work that we do, when you do encounter obstacles, barriers, that traditional red tape or just tradition in and of itself, a lot of those things can pretty much hinder or not allow us to move forward in our recovery support efforts. So let's not be afraid to address them. Let's not be afraid to advocate for change.